The Ebola virus has claimed scores of people's lives on the continent already. Ayo Olowolagba, the head of Communicable Diseases for eThekwini Municipality, is on the line. Ayo, from your name, I presume you are originally from West Africa.
Yes.
Have you been keeping in close touch with what's going on with Ebola there?
Definitely I have.
And the feedback that you are receiving from professionals, is it aligned with the scare that we are seeing on global television?
It is.
Dr. Ayo, we've had a discussion with South African Airways, and they say they're taking no particular precautions about the Ebola virus coming to South Africa. Is that a sensible approach?
As far as I know, the precautionary measures is being taken on all our port of entry, whereby the temperature monitoring device is installed, and that is a reasonable approach. Of course, incoming flights from all West African countries are being closely monitored by the authorities in our port of entry.
And how is that done?
The temperature measuring mechanism is there. Anybody that passes through it and you are running temperature, definitely it picks you up. And then they would isolate you, and health officials are at the port of entry, and they will be able to examine you, interview you, and put you on quarantine if necessary.
Is it foolproof?
So that's the best that we can do for now, to detect people that are actively sick or showing symptoms of viral hemorrhagic fever, including Ebola.
And what are the symptoms?
The symptoms are flu-like symptoms. Headache, tiredness, sweating, diarrhea, vomiting, and rise in temperature. It's pretty similar to flu.
Just tell us a little more, if you would, about the Ebola virus's ability to be combated.
You see, where there's been an outbreak or you have a person that is sick, you've got to be in very close contact with that person to be infected. Either you touch the sweat or any body fluid, and that eventually gets into your own body. Either you don't wash your hands very well and you touch your nose or any mucous membrane, it can easily get in. Of course, if you have your skin that is not intact, you have a cut, for example, in your hand, that can enter. But you have to closely be in contact, in touch with a sick person before you can get Ebola virus. It's not like it's not airborne.
But what about if you happen to be sitting next to someone who sneezes? You don't know they have the virus. Would that be sufficient to pass it on?
But of course, that's the possibility, a rare possibility.
We also saw in the from the wire services from AFP that one of the doctors who's been treating an Ebola patient has contracted the virus. What might he have done wrong for that to have happened?
It's breakage in infection control procedures, most likely. You see, if you have very strict infection control procedure by anybody that is dealing with a sick person, whether it's a healthcare worker or their relative, you're not going to have it. But of course, a breakage in infection prevention procedure can definitely give any close contact, including healthcare workers.
Dr. Ayo, the last Ebola breakout, there was no problems in South Africa that we know of anyway. Are you confident that there's enough precautions that have been taken to ensure that we also are not exposed to this?
We have been assured by National Institute for Communicable Disease and National Department of Health, every possible precautionary measures is being taken to make sure that our borders is secured and anybody that is suspicious is taken care of appropriately. We are all on very high alert, and we are taking no chances. Any suspicion is taken seriously and accordingly taken care of.
Our thanks to Dr. Ayo Olowolagba, who's the head of Communicable Diseases for eThekwini Municipality.